everyone, today we'll be doing PRP, which is platelet rich plasma that is injected onto the face or microneedled into the face and onto the scalp. So platelet rich plasma, how we get it, we first draw blood from a patient, then we put it into our centrifuge machine and we centrifuge it. This machine will spin the blood at such a rate that it will separate the blood cells from the plasma. Then from that plasma, we then withdraw the plasma that is rich in platelets. That plasma that we've withdrawn, we then use it for the treatment after microneedling or directly injecting it onto the scalp or the affected area. What the platelets do is that they release growth factors that help in increasing the follicles of the hair. Then you get thicker hair growth and you get more follicles growing in that area. There are many causes why people start to lose their hair. One of them is from increased testosterone as you get in men, and they get male pattern baldness, and they also start to getting a receding hairline. That's usually a cause in men. It can happen in women also, who get an increased amount of testosterone in their blood, and they also start to get a male pattern baldness. So it's not a phenomenon for men only. Medication can also cause patients to lose hair. Some medical diseases like thyroid disease, for example, can also cause people to lose hair. Aging can also cause you to start losing hair. And one of the things that causes hair alopecia, which is what we call traction alopecia, is from the braiding and putting our hairstyles too tight can cause us to start using hair on the hairline. And this treatment is very effective for that. So in the meantime, we are going to spin this blood for about 12 minutes while separating the blood cells from the plasma itself. And ideally, a patient should have about 4 to 6 treatments of this nature, about a month apart, and thereafter just maintain by doing 2 treatments per year. Okay, so our blood is finished centrifuging, which means it's been spinning for about 12 minutes. And as you can see now, the red blood cells, or the bigger blood cells, have now separated very nicely from the rest of the plasma. Then from this plasma, we will aspirate the plasma that's rich in the platelets, and that's what we are going to use for our treatment today. So we do a little bit of swirling the fluid at the bottom because the platelets actually sit on top of where the red blood cells are. In this way, they rise up a little bit and then we aspirate. Okay, now we've drawn the platelet-rich plasma from our blood sample, and we use a needle that's called an SIT needle. It's almost like a plunger, but right at the end you can see there's a small needle, and that is what is going to go into the scalp as we are injecting the plasma. You can see the area that has got less hair and fewer hair shafts coming out of the scalp all around here. This is mostly from tying up our hair in tight ponytails over a period of time. Then we eventually lose the hair in that area. But she has quite a few follicles still present, and this treatment will bring about 20 to 40% more hair growth in this area, and the hair would also be thicker. So we will start. It's a relatively painless treatment, but our client can also tell us how it feels. How is it feeling, Asana?
I'm comfortable. I can feel that something's happening, but it's not painful.
Okay. So it's relatively comfortable, but the client can obviously feel that something is happening, but it's well tolerated. We haven't put any numbing at all on the scalp. She's got numbing cream on the face because later on we'll use some of her PRP also to micro needle the face and put it on her face. It's great for collagen stimulation. You can see a little bit of pinpoint bleeding as the needle is going in and injecting the PRP. But when you see that, we just rub it in so that it goes in even further. So now today when she goes home, we advise all our clients to not wash their hair for today. They can wash it from tomorrow,
Okay.
And not go and do excessive exercise today because we don't want sweating into these hair follicles. And thereafter, because her problem is from hair traction alopecia, is to not pull the hair as much. So even when doing braiding, to make it very loose at the front, and then it can be a little bit tighter at the back, because we're trying to preserve the hairline and we want the hair to grow back. For clients that come in that are ladies with a male pattern baldness, we advise that they must have a medical workup first, take bloods to test if they've got a high testosterone level, or to figure out if maybe they have an underlying medical condition. For clients where we don't know what it is, we also send them for a biopsy of the scalp to be done, so as to make sure that it's not some autoimmune disease that's causing their hair loss. Once we know what it is, what the cause is, we start treatment and we get the regrowth and re-thickening of